behalf of the Minister to officially launch the 2025 Heroes in Health Awards, and the nomination start now.
Aha mukoro ogu Dr. Urara yashobora kukiri kikuru abanya-Uganda kushomesibwa okuba kubasa kwekyebera endwara zitari zimwe na zimwe ezirimu shukari, sirimu, pressure hamwe n'ezindi.
It reduces the number, the lines, the many people coming to the health facilities. So it cuts across all aspects of health. So if you look at in HIV, government has invested in self-testing. And you know, when people, especially for men who have a lot of stigma, you can do a self-test, but then afterwards, then you can be able to be linked to a health facility. For women, you can do a self-injection, or you can do a pregnancy test yourself. You can do one. So you can also do for diabetes. You can do for all the other aspects of it. So we think that investing in self-care is the best, because the returns are more.
Enteekateeka egi ya self-care health group erimu abantu b'ebika byingi nk'abo abaine oburemu aha mibiri yaabo hamwe na Minisiture ya Gender.
Less than 50% of population is less than 16 years. So we are looking at that. We need to be able to start embedding this. So if you looked at our self-care expert group, it included all sectors. It included people with disability, included the means of gender, because we're taking care of the youth which are out of school. We include the means of education. So we have embedded self-care messages, and that's why we are insisting in the school that physical education should be part of the education, so that people are able to do it, because now we are seeing we are contending with obesity.
Minisitule y'ebyamagara aine oburemeezi bw'abashaho bakye kirikureetera obuheereza bw'ebyamagara bwaguma. Abantu batandika kwekyebera oburemeezi obu nibwiza kuhwaho.
First of all, that is able to cut costs. It's able that ministry is having challenges of different number of health workers, and we do not want long lines in the one, and we would want that the health workers who are there are concentrating on addressing more of the patients who are sick. So if you are at home, if you can manage most of the things at home or wherever you are, then you find that the numbers will come. No? It also will save the patient the transport costs, the time he has spent in one, which he would probably be using to do one. So the returns on investment is very good for the individual, but also good for the one, for the public.
Dogo Singi niwe manager wa Bank Insurance yashoborera ngu okwekyebeza oburwire nikiza kuyambaho abo abatari kubasa kutambura kuza omu marwariro.
Equity, we're trying to make sure that everyone can access health, just as I mentioned earlier about universal health coverage, is that all people can access health without financial hardship. So the whole intent and objective of self-care is so that those that can't walk into a private facility or a public facility, or it's far, or they don't have the resources, can still access the same type and nearly quality services even at home or in another setting.
Gasha kwa Ivan Nyesiga.